It's gone 12, so we'll start. So afternoon, everybody. You're very welcome to this week's executive Q&A and sort of roundup of stuff. Like I say, apologies for being a couple of minutes late. And we've just been in exec, and I was blithely going on and thinking we'd changed the time to 1 o'clock until I was reminded that we hadn't. Hence the delay. I'm really sorry. So where are things? I'm pleased to say we're probably continuing in the same vein as last couple of weeks. So the numbers across the country, people will be au fait with, and continuing to move very positively in the right direction in terms of the pandemic, and there's been an equivalent easing and starting to sort of pick up the threads of all sorts of bits of work again, which is a pleasing place to be. Sorry, late news. Oh gosh. Right, so Yolanda won't be joining us for personal reasons, so we'll have to make do ourselves. Yeah, so good news all in all round. The sort of headline from the organisation point of view still remains the same, that we've so many people have worked so hard to get us to this really positive position, and we must ensure that we don't let things slip and relax our guard with, you know what I'm going to say, around social distancing, use of PPE, and all the infection prevention control measures we're putting in place. We're in a really positive position, Amria will confirm, with regard to outbreaks. And again, there's been some brilliant work across so many different teams and services about maintaining the cleanliness and the oversight of how we support staff to keep the virus at bay. Continue to encourage everybody to put their lateral flow test results into the appropriate reporting channels. We've had a really big push on this over the last couple of weeks. It's really important that people continue to do that. I'm not planning to say a lot more about the pandemic and vaccines, the vaccination programme. Again, you'll see nationally the number of first doses is reduced due to the supply chain internationally, and there's not an expectation that's going to pick up until at least the middle of May. The other bit is, though, that the second doses continue to go apace, and overall the number of people receiving vaccines is really strong. There is still an expectation that those first cohorts down to the age of, I can't remember exactly what it is, well, over 18s will be complete by the end of July, and that there's still real strong push to make sure that that's the case. And they're just starting to describe what a booster programme for a third shot will be for everybody come the autumn. So that sort of maps that out. So just a couple of things on non-pandemic stuff, because I think it's really important, isn't it, that we start to, like I say, pick up some of the threads of this and get back into, let's call it business as usual. It won't be quite usual because I think COVID is here for some time yet. But for example, we've just been talking in the executive team this morning about the submission of the annual plan to make sure that as an organisation we break even with the use of public monies, but also one significant difference from recent years is that we will be part of the system plan. So the ICS, which we are a significant part of, will be submitting our system plans on our behalf. So that's another thing for us to think about. It isn't just about our own autonomy, and as the national strategy sort of becomes agreed and signed off, ICSs will become formal organisations within the health and care system and will be a part of it. So that has all sorts of implications for our autonomy and how our assurance and governance work. Might be a bit dry for an everyday conversation, but I think it's important that we're cited on that, and many people are playing into those conversations at many different levels. For example, as we talk about pathways of care for our patients and service users. So watch out for that. There's also lots of great stuff going on in terms of the Oscars. You'll be aware of the highest ever number of nominations, so that's really positive to see. And we're also doing work with individuals and teams about making sure that we're fully cited and nominating our people for national awards, because we have got some great examples of great services which are important that get recognised not just within our own organisation but regionally, nationally too. I think that's probably as much as I want to say by way of introduction for today. Sorry, I forgot to introduce properly Anne-Maria and Sue Elcock, our execs on the call today. I don't know if we've got any others. I can't see on the screen. Anne-Maria.
If you've finished, John, your introductory bits, I've got a few bits I could do with mentioning to people, if that would be all right.
Over to you, Anne-Maria.
Thank you so much. I'd like to introduce everybody to my friend called The Mask. And today, the mask is really important. And the reason I say that is it's become, well, we've got wind that local authority and police have decided they no longer have to wear masks in any of their offices. And so therefore, it's really difficult for our staff because they're going into an environment where nobody's wearing masks and they are still wearing masks. So my plea is this, and we've stuck to this throughout the whole of COVID since last March. And I just wanted to say is that when you work for the Trust, you adhere to our policies and guidance. We're here protecting you. We honestly look at all the national guidance. We take the Public Health England's advice, and that advice is that you still wear masks and you still social distance. And I'm really a little bit surprised, you know, I'm not dissing my colleagues in the local authority or police, I'm not saying that, but I am surprised that they've taken that decision because publicly the government are saying that if you are in an office environment, if you're in a closed environment, you still need to wear a mask. So that's the long and short of it. So I just wanted to say, I want to welcome you to the mask, but also I'd like to welcome you to the mask because I've been out and about a little bit more over the last couple of weeks, which I've absolutely loved, but you still all have a tendency, some of you, to touch the front of your mask. And I just need to say, that's not for touching, all right? You need to stop touching the front of your mask. So please, please, please bear it in mind, wear it properly. When you put it on your nose, right, you can touch the bottom of it and you can touch the top of it. But then thereafter, never touch the front of it because your hands have got natural oils on them and it disintegrates the front of the mask. But also the front of that mask has got lots and lots and lots of bugs on it because it's being breathed in through your nose and your mouth. So just to big plea, respect the mask. It's there to protect. And then the next one I think I just wanted to mention is that we've become aware and that we've got some really fabulous people out there doing some really fabulous representing at regional and national forums. So it was just to say that don't feel that you've got to do all that on your own because you're representing the Trust and you're representing your clinical practice. But actually we're here to support you. So we can big you up, we can get you out there, we can social media you, but we can also give a high level of support, and particularly the executives. We're really keen and interested. You know, you don't have to be out there on your own. So just let us know what you're doing, what you're representing, and maybe we can input into it, or you can then have some way of feeding it into the rest of the Trust. You've got a conduit then of that information that you're receiving. So that was that one. And then the third one, I just wanted to mention something really, really brilliant, is that Keely Sheldon put us forward to the National Community Health Project to look at how we manage the workforce in the future for community health. Now, that's not mental health, that's community physical health, okay? I just wanted to be clear about that. So we're talking community practitioners, district nurses, those kind of people. And those fabulous staff, we're going to do a big piece of work nationally. Now, we've also taken part in a big programme on Friday, and following that, they've now come forward and said, could we be the pilot for it nationally? So down to Keeley, who's doing some fantastic work, and her team of senior leaders. And we had 35 district nurses and community practitioners on the call on Friday, all whooping it up and saying, yep, let's do this, we can do it. And I noticed on Twitter, they're amazing on Twitter. They were all there really sort of backing it and making sure that we're out there doing it all. So it was just those three pieces. I just wanted to sort of like say, respect your mask, representatives, and we've got a really fantastic opportunity to pilot community health across the country. Thank you, John. Over to you.
That's great. Thanks, Anne-Maria. It's Alex.
Thank you, Alex. Oh, hi, Alex.
Sorry. Sorry.
Nice to have you back.
Just to go into the questions, Tim Shields has asked, or Timothy Shields has asked, has our lateral flow testing reporting improved? And I know that's one of your favourite topics, Anne-Maria.
Do you know what? It genuinely is my favourite topic. But Timothy, you've asked me a question I genuinely don't know the answer of. I haven't seen the latest numbers, but I need to do a big shout out to a practitioner in the community health division who actually devised a poster for the toilets to say, have you checked your flow today? And I just thought that was amazing, because people are doing some really, really innovative things out there to get people increasing their lateral flow testing and then reporting it into the systems. But I'm really sorry, Timothy, I haven't got the answer as to what the numbers are at the moment. Yes, we were really bad and we were only at 15%. But I know through the conversations I'm having and the plea that I put out on the closed Facebook page that people are seeming to respond better. So we will get those numbers to you at some point. But thank you for the question, because you know I love talking about it.
That's great. Thanks, Anne-Maria. Also, there's a question that's been sent in which states, in last week's exec Q&A, Anne-Maria stated that there were currently 3 outbreaks of COVID-19 on trust wards, and there's a few follow-up questions. The first one is, what percentage of those who tested positive had a clinical presentation of symptoms?
Oh no, that's a really, really, I think it's an excellent question, actually, because there's a couple of things that I suppose I want to relate to that. So what I'm finding is approximately 2 to 3 people out of 10 are showing symptoms. The rest are asymptomatic. So the last 2 outbreaks that we had, we didn't pick it up from people being symptomatic. We picked it up from people being asymptomatic through the lateral flow testing. However, what I am finding is a more recent, I haven't called it an outbreak yet because they're 2 separate patient cases. Both patients were asymptomatic and they were picked up on the testing regime that we have for patients coming into our trust. So you're tested on what, day 1, day 3, day 7 and day 13. Those are the days you're tested. If you are tested post 8 days and you are positive, then you have caught it whilst being in the trust from ourselves. If you come in and you're tested on what, day 1 and day 3, and you become positive on either of those days, then it's what we call a community acquired infection. It means that you've brought it in with you, you had it, you were incubating it. So there's a couple of bits really around the fact that each outbreak I've seen are very different, but it tends to be picked up through asymptomatic testing, which is lateral flow testing for staff, and patient testing, which is PCR testing, that regime of 1, 3, 7 and 12 and 13 rather, that's picked up asymptomatic patients. So I do still have a couple of staff that are reporting symptoms, and interestingly, and this is the big thing I want to say to all of you, is I do have patients and staff that have tested positive on PCR that were vaccinated So they have picked it up again, but they're not as poorly. So a lot of people are asking me, what's the point of having the jab then? I tell you that there's a very, very clear responsibility to have the jab, because you will not be as poorly. You may be you have a couple of symptoms and you will not be as poorly as you were. If you don't have the jab, the highly likelihood is that you will be very poorly and potentially really sick. I'm not sure if I've answered the whole question there, Alex. I heard the subject and I went off and talked about everything to do with it.
I think you have, Anne-Marie. Thank you. One of the further follow-up questions is why are staff on the vaccine bus being told that they are not allowed to tell citizens the ingredients of the vaccine? Several people have reported this concern, and it seems strange that the trust should be soliciting vaccinations without informing people of what they're actually being injected with. Thank you.
Oh, I'm not sure I can answer that question.
Well, shall I? I'll make a start. I don't know whether Sue might want to come in with her sort of medical perspective on it, but so there's a whole load of issues with regard to some of the vaccinator bus and its journey. So it's been targeted specifically by some anti-vaccinator people, and it's led to some quite challenging conversations. Police have been involved, and we've had to manage through that. Whilst at the same time, from a more positive perspective, it's been really well received by local populations, because it's the bus route has been dictated by the feedback on the areas of relatively low uptake, so particularly into vulnerable communities in City of Nottingham and in Mansfield, where it was, for example, yesterday. And local people are really supportive, and there's been really good uptake, and it uses its supply every day that it's been used. In terms of the specifics, a leaflet is given to everybody that receives a vaccination, which gives full load of details about the vaccine, the side effects, the risks, etc., and what to do in the event of an issue. I doubt very much it specifically details all the contents of the vaccine. I think it's unlikely that the staff will have been told specifically not to. I think it's probably more a case, as with most medication dispensing, that people won't know all the contents of everything that's being provided. I don't know, Sue, whether you want to say any more about that.
To be fair, John, you've just said everything I was going to say.
That's fine. That's fine. I think it's probably a good example of there are some quite polarised views around the pandemic broadly. The lockdown, the use of vaccinations, and that is being picked up in a microcosm within the bus. So hopefully that covers that question off, Alex.
That's great. Thank you ever so much. There's one final question, which is the trust concerned that those who are receiving vaccinations cannot give informed consent? And it states Public Health England say that informed consent must include being informed of potential long-term side effects and any medication being received. This is not possible with the COVID-19 vaccines because there are no long-term data on side effects due to the very recent and rushed trials. This is evidenced by the fact concerns about blood clots only materialised after 30 million doses had already been administered. And I'm just reading that verbatim, that question verbatim that it came through. So I don't know if you...
It's really difficult, isn't it? Because you have to take it in the context of where we are and where we've been with the pandemic and what is known. So informed consent is about making the decision on the basis of all the information you have to date at that point. So whilst I get the point about we don't have long-term research, the national sort of figures that have talked a lot about this have said it isn't that they've shortened and therefore not done the appropriate trials on the vaccines, but that they've been able to do it in a much speedier way, but have done all the processes as if it was the normal longer term. So from my perspective, I think it has to be seen in that light, really.
That's great, thank you, Sue. And just to add that Mark Howells has added in the chat, head of research, that the info sheet should include all ingredients.
I said I'll ask.
They should be called. Sorry, I need to go back to school. So thank you. And one of the questions Timothy Shields has followed up with, are we able to access support for staff who are experiencing long COVID?
Yeah, so there's at least two ways. So the one would be through our own health and wellbeing team. That if any of our staff got concerns that they might be experiencing long COVID, one of the challenges around it is it has so many different ways to present with a whole range of different symptoms, and health and wellbeing team will be able to have a conversation and point people in that direction. And then a more traditional way would be through primary care GPs. So GPs now have access to through Choose and Book to select from their menu referral to long COVID services, which would work on a sort of triage conversation first to identify the best place for that individual to receive help because of aforementioned wide variety of symptoms. People may present, for example, with very significant impairments of energy and fatigue, which might be a different referral to someone that's got, say, a range of anxiety and depressive symptoms. So they're the two main ports of entry to receive support. And the other thing to add about long COVID, it's this service is very new and will be something that sort of gestates and grows as we get more skills and expertise about what works and how to manage people with emergent long COVID. And it's seeming, isn't it, that you read some of the national stats that it's more prevalent than originally thought. Thanks.
Thanks, John. Tim, apologies, I've just scrolled up and seen that you're saying it is Tim. So if you felt that you were being told off in your Sunday name, being called Alexandra, I know that feeling. So just to go through as well, thinking of some of the health and wellbeing aspects, and Natasha is from our staff health and wellbeing team and has highlighted some of the issues that have been highlighted within an online health and wellbeing drop-in session. And so what she's stated is that there's some emerging challenges of home working and the pending post-COVID impacts. And has stated that the impact of working from home and remote working include vicarious trauma, compassion fatigue, exhaustion levels, burnout, MST, equipment, physical impact. And then she's also stated that staff support, what will be the anticipated impact? What can we do additionally to support ourselves and our teams? And new guidelines working from home. Is there a role for additional psychological support and supervision for staff? I don't know if who wishes to address any of those.
I'll start. Is it Natasha? That is a really good summary and question in terms of what you described there, and it's really important, isn't it? This is all new to us, and our response is going to be critical in that we get it right, and we shouldn't automatically, and we're obviously not thinking that home working's fine. You're protected and don't worry too much, and get ready to come back when everybody's ready. The world has changed, and all the sorts of things that you've described in that summary are really important threads up to put in the mix about, okay, so when we or as we continue to describe what I usually refer to within these conversations is that mixed economy of some people will predominantly work at homes, some people will completely work in clinical services, and there'll be a range within the middle. we need to make sure that that offer that absolutely includes health and wellbeing and psychological support isn't missed by those that aren't coming to a work environment on a regular basis. And there's a broader thing, isn't there, about the being part of a team, and that's social and being at work and mutual support, which is easy to miss, and then the psychological impact of that. So I think, whilst I haven't got specific answers to that, I think they're really good points, and I'm sure we are making sure that they're included in our description of what's next. Hi, Natasha.
Hiya. It came from our health and wellbeing drop-in, and it was from somebody that was working from home, and it was a question from them. They had some kind of points on it, and I thought it was very important for me to kind of put it within here for you, the execs, to kind of know what people are thinking. So we don't have to have answers instantly. It's not what I'm looking for, but it's just something that somebody's brought up, and I thought it was very important to kind of pass that information on. So thank you very much.
No, spot on. You made points really well, and yeah, it will really help inform how we describe that area of work. Thank you. Nice to meet you.
Thank you ever so much, Natasha. That's great. Hanny's put into the chat, patients with borderline personality disorder who have recurrent suicidal thoughts and behaviour and are risky, who are asking for treatment. Some services have a long waiting for a year to 6 to 7 months. Can more resources be put in to provide faster service, please?
Yes.
Oh.
Hi, Hanny. As ever, very good question. So again, we just reviewed in the exec team this morning some of the additional monies coming through from the national programme to transform and expand mental health, learning disability and autism services. I could throw a whole load of numbers at people, but just to give you some context, that in a good year, traditionally, we might get $500,000, $1 million to improve services, improve outcomes, pilot stuff, and that's been the case for many years. This morning, the latest addition of the various monies we're getting into various services, which includes developing personal networks, the services that you're alluding to, Hanny, is nearly 19 million for NOTS. So that gives you a sense of the quantum difference. That's, I think, for once overcoming the rhetoric of all mental health services are important and never getting anything. And actually, I think one of the challenges that we're going to face is being able to recruit all the people that we need to recruit to be able to spend the money. So it's but it's a really good position to be in, and I think Julie Atfield, who are on the call, should be able to give you a bit more detail of some of the specifics around the borderline personality disorder service and how that links into that network, so that, for example, earlier intervention, crisis support, ability to provide alternatives to admission would really help improve people's experiences, but also outcomes too. So it's a really positive position to be in.
That's great. Thank you so much. Sorry, does somebody want to say anything? No. Okay. Just to highlight that Angela Walker, linked to the COVID discussions, has added CIPD website, also have resources, re-COVID, return to work, and research about flexible and remote working and case studies. Heard it in a webinar but not looked at it yet. That's great. Thanks ever so much, Angela. And we can absolutely start to share some of those resources as well, so we can add those to and share those out. Thank you. Other questions that have been sent in. As it's World Immunisation Week this week, have we done anything as part of this? John?
Yeah, sorry, I was muted myself.
Sorry.
Yeah, so I think this would have been a question that Yolanda would have answered, because the answer is yes. I'm sorry if this sounds a bit reedy outy, but the week has provided a chance to highlight the fantastic work of our school-aged immunisation team. So big shout out to them, which offers routine vaccinations to young people and the importance of receiving routine vaccinations to ensure people have the best possible chance of avoiding infectious diseases. Listen to this. The team has delivered 62,886 flu vaccinations over 5 months. And it's also been supporting the COVID-19 vaccination programme. So a massive well done to, I'll say it again, the school-aged immunisation team. There's more information about the team and their work on the website.
Yeah, that's great. Thank you ever so much, John. Just to add to that team, my daughter gave them high praise when they went in and did the school vaccinations, as well as all of the flu and the others. So yeah, absolutely great team. Thank you. Will the trust be celebrating the NHS's birthday this year?
Nah.
No. Okay.
Sorry, yes, there's an answer. Of course we will. It's on the 5th of July. And the comms team, via Yolanda, Suzanne, Christine and all, would welcome your ideas to how the trust might mark this occasion, given the amazing response and work that so many people across all the NHS and care systems have put into helping us get to this much progress in the challenge the pandemic's provided. So I think it might be quite a special occasion, actually.
Yeah.
Joke aside.
Excellent idea there from Mark Howell's. Birthday cupcake for every member of staff. So great, thank you. And the final question that's been sent in, and I know that this is something that's being asked of the our payroll team quite frequently at the moment, is that when will P60s be available on ESR?
So, as I'm sure you'll be aware, I'm completely all over this. Apparently,
I was going to say, I do know the answer to this, actually, if you want some help.
Go on,
have you got the answer there, Dr. Brewin?
I thought you knew it. You knew it because you knew it, rather than I can see.
Well, only because I'd seen it. We got posted. This question also got posted on the Post Facebook page. So they've said that it'll come out at the end of May.
31st.
Yeah. No, that's great. So yeah, I know that people are very keen to get their hands on them. So yeah, so end of May. Thank you ever so much. Linda has added into the chat, we have International Nurses and Midwives Day on the 12th of May. We will share more details about this next week on Connect. That's fantastic as well. And Anne-Maria, I noticed within the chat there hasn't been any further questions, but I just wondered if you wanted to say anything about what you put in the chat with regards to Catherine Pope.
I would love to. I would absolutely love to. So I haven't been in the trust that long, but already, you know, as soon as I started, I had a lot of forums, loads of meetings, all on MST, and actually coming out and about as well. Catherine has always been in attendance. She's contributed. She's really such a massive advocate of both the services that she supports, but also AHPs, now, you know, for the whole trust. And I have to say, whenever I used to think, oh, Catherine's on, that'll be all right, because she'll either ask a question or she'll help me answer a question. And it's a lot, you know, when you're new in a trust, you're not sure how everything pans out. But actually, she was genuinely a really lovely person to have in any forum. So this is a massive shout out to her. I know that I've made a bit of a personal thing about it there, but the whole trust thanks you for your massive contribution to the NHS, services and AHPs alike. So this is just to say huge thank you.
I'd echo that. Catherine doesn't want to put her camera on because she's embarrassed. No need to be, Catherine. I've known Catherine longer than you, Anne-Marie, because way back in the day, we were working together in it must have been the early 2000s. So as well as that, the fabulous hi there, Catherine. That commentary, Anne-Marie. The other thing that Catherine's done is she's been at it a long time. And it takes a lot of toughness and resilience to be in that leadership position across all those years, as well as the fabulous work that Catherine's done as well. So I just wanted as well, Catherine, to thank you for that and to wish you all the best in your retirement, and just be interested to know what's on your list of things that you're going to be doing in your spare time. Come on.
Puppy training.
Oh, right, excellent.
And also not doing anything. Thank you.
Well, all the best. All the best and enjoy.
Definitely are. Congratulations, Catherine. Oh, that's great. I'm so jealous. Puppy training, fantastic. Is there anything else that you'd like to say, Anne-Maria, John, or Sue?
I've got one. John was so disappointed if Anne-Maria didn't say, yeah, I've got something I need to say. Right, I do have one thing. This is a bit of a plea. So as you are aware, the government have changed tack on, hands, space, face, and now they're putting in ventilation. So during the winter months, we were trying to be really kind to all of you and say, look, we understand it's really, really cold, so just have your windows open for 10 minutes every hour. But what we found is it's really hard to monitor that and ensure compliance against that, because actually that's quite hard. And, like, how do you say, right, I've definitely done 10 minutes every hour. So now that we're getting into the warmer weather, we want to encourage people to have windows open all the time. And that will help with regards to the viral load of COVID and also other infections as well. We've got lots of lovely bugs hanging around. I don't know if you've seen the news recently, but there's a real concern for children's health because they've all been in lockdown. They've not been exposed to all of the usual colds and coughs and RSV. And actually the acute hospitals are starting to ramp up with admissions because of people starting to mix, particularly from a children's perspective. So that high viral load is really important to rid it and do as much as we possibly can. So my plea now is, and I know that there'll be exceptions, I know that, but wherever you can, please leave a window open, particularly in offices, closed spaces, anything that you're working in. Make sure that you've kept the window open and then close it at night. So, because that'll be the next thing. I'll have to remember to tell you all to close it at night for security. But please, 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 that's my plea. That's the new thing that we're going to be sending out. That's it. Thank you.
Thank you. John, is there anything?
Yeah, the only other thing, Alex, and I might need to check with you on this, that alerting to people to the fact we will be changing the frequency and the timing of this meeting.
Yeah.
Hence the blind panic I was in at the start today, because I thought we'd already done that. But we're going to be moving the time from 12 to 1 p.m. Correct me if I'm wrong, Alex.
Yeah, that's correct.
And we're going to be making it every fortnight instead of every week.
Yeah, from next week. So there's one next week. So the first one at 1 o'clock is next week on the 5th, and then we've made the dates so that there's no clash, so that there isn't a Q&A alongside a Connecting Knots event. So the first one is next week at on the 5th at 1 o'clock, and then it goes every fortnight after that. If anybody wants that to be put in their diaries, please email staff engagement. It goes into a lot of people's diaries already, but it also goes out trust-wide as well. So
we'll be putting into various comms as well, so that people are aware of it. So that's great. So now the only other thing for me to say is thank you very much for everybody joining today and for your contributions, and also more broadly across the organisation. Please pass it on to your peers. The more that join this conversation, the better. So thanks very much, and have a good afternoon. Thank you.